Hi, my name is Jonathan Martinez, and I will be presenting you with an informative video on bipolar disorder. What is bipolar disorder? Bipolar disorder also goes by manic depressive illness or manic depression. This disorder causes uncontrollable mood swings, affects energy levels, affects activity levels, difficulty concentrating, and the inability to do day-to-day tasks. There are three types of bipolar disorders. They all have these things in common: unusual changes in the mood, energy, and activity levels are all affected. Moods being in the range of either up or down, up being energized manic episodes, down being sad and depressive episodes. What is bipolar 1 disorder? People who have bipolar 1 experience manic episodes, episodes where a person is feeling high energy, which is somewhat of a euphoric feeling. These episodes last at least 7 days, if not more, and usually, people that are affected need some sort of medical attention. Depression is seen in bipolar 1 as well, and could last up to 2 weeks. Symptoms of bipolar 1 can be excessive spending, substance use, inflated self-image, hypersexuality, increased energy, and loud speech. Unlike the other types of bipolar disorders, bipolar 1's manic episodes are more extreme and are more noticeable. What is bipolar 2? Bipolar 2 is defined as having episodes of depression and hypomanic episodes. Hypomania is the toned down version of mania. It is less than manic but also is associated with high energy, although the mood is more controllable compared to manic episode. Symptoms of bipolar 2 are having a euphoric feeling. It's not as extreme as bipolar 1, but it is also associated with deep sadness, depression, guilt, excessive sleepiness or insomnia, and a general disconnect from reality. Bipolar 2 is different in that episodes of severe depression and mild episodes of hypomania alternate. What is cyclothymic disorder? It is the third type of bipolar disorder that shows periods of hypomanic symptoms and depressive symptoms that last at least 2 years. The symptoms are not as bad compared to bipolar 1 or 2, but experience high and low moods as well. Symptoms are mood swings and irritability. Cyclothymic disorder is not as serious as bipolar 1 and 2, but does last longer than both. How is bipolar disorder diagnosed? The first step is to complete a physical exam with your healthcare provider. The test can help rule out other conditions that could affect proper diagnosis. Furthermore, the healthcare provider will then conduct a mental health evaluation. From then, the results will help the doctor with clarification to properly diagnose a person. Bipolar disorder may be the proper diagnosis, but other disorders such as anxiety or others can be prevalent. Bipolar disorder has no cure. Treatments for bipolar disorder vary. Medications can help manage symptoms of bipolar disorder. Antipsychotics, mood stabilizers, antidepressants, and sleep medications all help fight against bipolar disorder. A person that is affected by bipolar disorder and is given prescriptions to help with their symptoms must take their medication consistently in order for their medication to work properly. Psychotherapy consists of talking with a professional in order for the patient to learn how to control their emotions, behaviors, and thoughts. Therapy combined with proper use of medication is the best way to treat bipolar disorder. In addition, it is also important that a person with bipolar disorder regularly exercises, also keeps track of their symptoms, such as keeping a daily mental health journal, and eats a proper diet. When it comes to the prevalence rate of bipolar disorder, about 2.8% of adults in America had bipolar disorder in the last year. About 4.4% of adults in America have experienced bipolar disorder in their life. A person may be more likely to develop bipolar disorder due to their parent or sibling having bipolar disorder. They have an increased chance of developing the disorder in their life. Periods of high stress or a traumatic event can also cause bipolar disorder. Abuse of drugs and alcohol can also be a risk factor. 1 in 5 people suffer from bipolar disorder. It is not as rare as people think. Mood swings are not in the normal range compared to a normal human being experiencing normal mood swings. The ranges are more wide-scaled. There is not just one type of bipolar disorder. There are more than one type. Ultimately, there is no cure for bipolar disorder, just treatments for symptoms. In my personal experience, my mother suffered from bipolar disorder just before passing away in 2018. She loved me throughout her whole life and raised me until 20 years old just before passing. She taught me manners, she taught me how to drive, how to get a job, how to treat a lady, how to work hard. She taught me not to give up and taught me many other things about life. She was a single mom, and just looking at her, you couldn't tell she had bipolar disorder. She was kind, loving, funny, and smart. She did suffer from episodes of mania and depression. They were very uncontrollable. Even though she saw a doctor, was seeking therapy, and taking medication, she still suffered from her symptoms. There were times she had to be put in the hospital in order to regulate her mental health and medication. Overall, I know she isn't suffering from bipolar disorder anymore. Bipolar disorder should be taken seriously, and those affected by it should seek help. Proper therapy, a healthy lifestyle, and medication combined can aid those suffering from bipolar disorder.